Hi, Holistic OTs. This is Emmy Vadnais. How are you? I wanted to share with you some of the most commonly asked questions that I have been receiving over the past year or two, because I thought it might help you in what you're doing. And I thought I would just share a little bit on each of these questions that I get. And the first one that I get asked a lot is, where do I start with integrative health? Now, I realize that for those of you listening, everybody's on a different, level of your journey. You might be at the beginning. You might already have been practicing integrative health for a few years or longer. And what I usually tell people, and I have this on the frequently asked question page at holisticot.org, is what are you most interested in? What is calling you? What would you like to learn more about? And I think that's a great place to start, because that is going to keep you interested. And we all know that the more that we are interested in something, the more that we're going to actually learn it, pay attention and learn it. I do think that it's very important to have some training in meditation, relaxation techniques, perhaps guided imagery, mindfulness. When I say perhaps, obviously, I'm a huge fan of those, but perhaps meaning that you may or may not feel drawn to those. There is a ton of research on the value of what meditation can do for people, the relaxation response, and how it can help the physiology shift it into that rest and digest, and the opposite of the stress response, so that people can make healthier lifestyle choices. And mindfulness, as we know, is very popular. Mindfulness is really cool because it's something that you can practice, and all of these approaches are great for your own self-care, but you can practice it yourself and then teach it to your clients. They can use it as a form of a meditation practice, a seated meditation practice, or they can take their mindfulness that they've learned through that seated practice and take it into their activities of daily living. And it can be really powerful to observe our feelings and our emotions while we're going through an activity with less judgment, be able to allow ourselves to come into the present moment. Excuse me, not thinking about the past or the future as much as possible, and really being able to be present and enjoy what's happening here and now, which I know is not always an easy thing, because there are certain things that might trigger us. There are challenges and experiences that people go through that can maybe seem beyond what they're able to cope with. And so while, yes, these approaches can be helpful, they're not a panacea. They don't work for everybody 100% of the time and 100% of the cases, but they can be very helpful in a lot of cases. And so I think it's great to have those mind-body techniques, have some training in that. And as you probably know, I have created a lot of classes on holisticot.org, and also they're available through my emmyvadnais.com website, through like the meditation for healthcare professionals class. I've got the power of the mind and healing class, an intro to breathwork class, which don't let the name fool you. It's actually full of a lot of great science and research. So those are great skills to learn, and also to immerse yourself in them. Now, let's say that you've been practicing these techniques for a couple years, or maybe even over 10 years. So my advice to you, if you're not already doing this, you might be, is to have a daily, regular meditation practice, being able to quiet the mind. And that is going to deepen your ability to serve. It's going to help you develop your intuition. You probably know I've written a whole book on that, because that's what's really enabled me to be on this path before mindfulness and yoga have become so popular, is that intuition, being able to quiet and go within and listen to my inner voice, or maybe you believe it's God or angels or whatever that is, to help guide you and continue to guide you on this path of how you are serving, so that you can feel more whole and complete. You can heal past wounds, and you can serve in the way that gives you the most meaning and purpose. Because ultimately, in my opinion, that's what it's all about. So then, of course, it's taking classes that appeal to you, and then practice. I know that sounds very simple. Practice meaning provide sessions to people. serve people with the techniques, your newfound skills that you have learned. And if you are in a mainstream setting, in a mainstream healthcare setting, a hospital, acute, long-term care, skilled nursing, whatever it is, home care, you can bring these approaches into those settings, even by teaching people some simple mind-body practices to help them manage stress and pain. Because as we know, when a person has less stress and anxiety, they generally have their pain levels come down as well. And of course, there might be a time and place for pharmaceuticals. I'm not suggesting that these are meant to replace that, but that's why they're called complementary and integrative, is because they can be used with other approaches as well. And we need to be part of that team and know that our client has been evaluated for whatever pain they're dealing with, so that we're careful that we're not trying to treat pain when we don't know really all what's going on for somebody. And if you are in a mainstream setting, the person's already probably been seen by one or many physicians. But if you are in private practice, it's always good to ask your client, have you been evaluated by your primary healthcare practitioner for your chief complaint that you're wanting me to serve you with and support you with? So those are just some ideas, some things to think about how do I start or how do I deepen my occupational therapy with integrative health practice, is to have your own daily practice, whatever that is for you, of using these approaches, practicing them for your own self-care, because that's going to deepen and strengthen it for how you're able to serve and support others. To, I think, have a regular meditation practice. If you're maybe have particular spiritual or religious leanings, maybe you can weave that into your prayer practice or your worship practice, whatever those terms are for you. And to take classes, but to be careful to not get stuck in this pattern of thinking that you have to take more and more and more classes in order to practice. Yes, we are all lifelong learners. There's so much to learn. It seems endless. I think it is endless. I think we're going to always be learning, but to know that you don't have to take years and years and years of education in these topics in order to start serving others in these topics. You can start, depending on the class you're taking, at least my classes, you can start right after you've taken those classes, because I teach you those skills you can integrate right away.